Welcome. Thank you for joining us today for this Friday coffee chat, Living Through the Pandemic, What Can You Do? I'm super excited about our presenter, Matt Bennett, who's going to talk about how we can all feel what's going on in this 11th month of the pandemic accelerating in the United States and think about where we go from here. Before I turn it over to Matt, just wanted to let you know that this webinar was supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services. And of course, the information and the opinions shared here do not necessarily represent the official policy of HRSA, HHS, or the U.S. government. Matt is going to speak for about 40 minutes today. In that time, if you have questions or comments that you want to share, feel free to type those into the chat. And I'll be keeping an eye on that as we go along. And then at about the 40-minute mark, we're going to open it up for discussion. So any questions that haven't been addressed, Matt will have an opportunity to talk about anything else that folks want to discuss or explore together. We can do it at that point. So thanks again for being here. Oh, I also wanted to let you know that the council has been working on a written publication of our Healing Hands
Let me just make sure. Let me see who's
media that is going to address similar topics of sort of staff burnout in the healthcare for the homeless world, and how we can support each other and keep going through this. And that is going to be available on Tuesday. And so everyone who's registered for this webinar will get that by email once we have it published. So welcome, Matt. Thank you for being with us. I'm going to stop sharing my screen and turn it over to you.
Oh, thank you so much. Happy Friday, everybody. Let me get my screen up here. Let me know if you can't see that. Hopefully that looks good. It's just such a huge honor to have a short little period of time with you all. My name is Matt Bennett. I'm a huge fan of the National Healthcare for the Homeless Council and the work that you all do. If you're like me, while probably everybody understands why the conference is going virtual this year, 2 years without an in-person Healthcare for the Homeless conference. Oh man, that is hurting me. So just a huge virtual hug to you all. If you haven't seen me talk before, basically to sum up why I'm here today, I got exposed to the Adverse Childhood Experience Study in about 2003. At the time, I was running a lot of community-based programs, including a housing program. Even with my background as a therapist, I couldn't really explain why some folks got stuck in these behaviors, why I saw certain sort of responses that didn't always make sense to me. I saw so many answers when I started to learn about the impact of trauma. But very, very quickly, what I also saw was a lot of staff were acting like we were also traumatized. This was before I heard the words vicarious and secondary trauma. So very quickly after I looked at this, I started to think about, well, what does it mean to be a trauma-informed organization? What's the role of self-care? And the other initials behind my name, except for representing my student loan debt, is, you know, I have an MBA in healthcare administration. So really thought about this from a leadership perspective as well. And obviously during the pandemic, I have spent the majority of my time thinking about how do we maintain wellness, both within the organizational context, a big focus today on a concept that I'm seeing bubbling up everywhere, which I think is really good: moral injury, moral distress. So we'll explore that as well. You got my email here. I'll put it in the chat at the end. You'll see it on the slide. If you're new to me, because if you've heard me talk, I probably don't have to say the next thing. I love talking about this stuff, so don't hesitate to reach out to me with any questions that might not get answered. If 40 minutes of me isn't enough, it might be plenty for you, at least released at the end of this week, but I think there's now like 220 hours of my podcast out there in the world, as well as books I've written. There's a blog out there as well. So plenty of me if you need some more, Matt, in your week. So let's get started here with looking at some really concrete things. I hope to give you 3 or 4 things that are sticky enough that not only do you remember them Monday, but they will continue to be a part of your thinking as we continue to survive in our current situation. And I think sometimes the best we can do is give ourselves permission to, hey, how are we going to get through the next couple months? How are we going to stay as healthy as we can and get through? I don't know. I think Fauci told me maybe the end of the summer when enough people get vaccinated. But, I know we're going to be in this struggle for a while. So if we're thinking about surviving, and as we transition back into whatever normal looks like, eventually, as we'll talk about, we already were working in tremendously high stress environments before COVID hit. I want to give you some simple ways to think about self-care, but also the health of your teammates and your organization as well. One of the simple balances here is balancing helping fatigue and helping satisfaction. So we know that there's a lot of challenges to this work. We'll define and talk about moral injury, burnout, trauma, whether we talk about vicarious secondary trauma or something we can just call trauma that's going on in our workplaces right now. And so there are a lot of challenges. And, the most recent survey I looked at, the top categories for burnout. So, and I like to think about this, like I said, I realized during COVID, it got reinforced. I already knew this. I'm not a very smart guy, so I've always got to break things into really simple, like analogies to get me to think about it. So one of the things I thought about is that if you packed a stadium in your community full of people and you had some mental health resources and all you knew about folks was the work that they did. And so you had some mental health resources, you got a stadium packed full of people, you want to get the people in most need of help, assistance, but all you knew about them was their occupation, you would call physicians up first. Physicians are number 1 on the burnout list. Number 2, nurses. Number 3, social work and social service workers. In other ways, if we were to try to find the most burnout organizations in most communities, it would probably be you all. And that just speaks to the challenge of our work. And so we weren't doing well before 2019. There's an analogy a lot of self-care users or self-care trainers use about, when they're giving you all that information at the airplane, you're supposed to put your mask on before you help someone with their mask. I get what the analogy is about. But our plane's been crashing for years. At some point, we got to stop the plane from crashing. And that's healthcare. Education's next with teachers and principals. After that, we have lawyers and police officers. So, this just speaks to the intensity of our work, and we'll define why that is here moving forward. But there's also great things about the work we do. I'm not sure about you, but my number 1 coping skill is I get to wake up every morning and be a part of making positive change in my community, in my state, in the country. I get to prepare for this training to work with my heroes on this call, doing this amazing work. Monday, I get to have a call with Pasadena Unified School District to talk about trauma-sensitive classrooms. Then I get to move on to working with HIV providers later in the week. And because I get up every day and try to make a positive contribution to the world, man, again, it can burn me out sometimes. It can traumatize me sometimes, but that's really one of my biggest protective factors as well. So making sure we just understand the privilege we get to do that. Team and organizational health, I still will say very strongly, even if you're a self-care all-star, if you have to go to a dysfunctional work environment each and every day, eventually you're going to be worn down and burned out by that environment. So making sure that we create those healthy environments, and then self-care as well. Now, again, when we look at nurses, physicians, social workers, basically everybody that walks into a healthcare for the homeless environment each and every day, we were not doing good before the pandemic. Then we have politics. If you remember, I think less than 25 days ago, our national capital got taken over. Like, we are in the midst of a political word I can't really describe without cussing, which I try not to do. And we live this, and we know that those elections in Georgia have a big impact on, hey, are poor people going to handle all this burden of this economic crisis? So really, we've been so anxious about this, not just because, hey, maybe we have a certain political philosophy, but we know how that trickles down and really impacts those that we are trying to help. A huge fight for racial justice. And I know I can say this on this call, Black Lives Matter, a long overdue reckoning around race. But this is also a challenge for us as well. As I'm listening to speakers, as I'm going to marches, it's one thing not to be racist. It's another thing to be anti-racist. And so a challenge to us personally, but, and I'm talking to warriors that go fight for health equity, social justice every single day of your life. There's systematic racism in healthcare. And there's a challenge to all of us, and we are going to need to address this because, we're just surviving right now. Might not be the best time for it, but we also need to take this opportunity to say, hey, is there any work that we need to do as an organization to live the values of equality, social, racial justice? And that's something, again, I'm talking to all stars, warriors in this, but we can all need to look at ourselves at some point when we have the capacity to do it, to say, how do we get better as well? And then obviously this damn virus. So if you're not feeling a little bit overwhelmed, if you're not struggling a little bit, please reach out to my friends at the council and get your own coffee chat, because I know, and I don't have to go to work in the environment every day. In other words, I'm not putting my health at risk because I work from a home office. We should be struggling right now because, again, we were already struggling before, and all this walks through our doors each and every day. So, quick analogy I want to throw at you again. I want to sum up a little nerdy stuff, because if Matt doesn't talk about the prefrontal cortex and the amygdala, it's not a Matt Bennett training. But when we think about how we approach our own self-care, our own wellness, and again, I'm giving you permission to ask, how am I going to survive into the fall? How am I going to survive and bring my best self that I can possibly bring right now into work each day? I like to use this analogy of a cup. Now, the cup's got two parts of the analogy. One is the size of the cup. And this really represents the health of our nervous system. A healthy nervous system is going to better manage stress in the environment, better manage moral distress, better manage something I'll call empathetic intensity, the increased workload that we have. As we hold stress for too long, it starts to really deteriorate the health of that nervous system. So when we think about resiliency, I like to think about this in the analogy as the goal is to live as healthy life as you possibly can. What that does, if you live a healthy life, your brain, which is part of your body, will operate optimally as well. So when we talk about how we manage stress, it's the prefrontal cortexes, the cognitive, but also the social part of our brain, the problem-solving part of our brain. But it also helps to regulate the emotional part of our brain, or the amygdala. I've also nerded out because I've had, a little bit of free time because I'm not jumping on a plane anytime soon. This polyvagal theory, where we can also look at this in our autonomic nervous system, and how our ventral vagal nerve helps to regulate the sympathetic, the fight or flight, or the dorsal, which is obviously overactive with depression as well. So we live a good, healthy life. And I'll give you some strategies around that very quickly throughout this training. We create a big capacity to hold stress. Just a word about the folks we serve. We know the folks that walk through your door each day, not only are they dealing with the trauma of homelessness, probably addiction, maybe some medical issues, whatever it might be, but most of them also come from a history of trauma that goes back to their childhood. What we know about folks that have survived trauma for again, most of the folks I worked with in housing, it would be hard to find a time in their life where they weren't dealing with some type of trauma, and obviously homelessness being a trauma. is that we see prefrontal cortex smaller in size, amygdala actually physically larger in size. In other words, a small capacity to hold stress. This is why it doesn't take much to get folks into that fight, flight, or even freeze response. So a quick way to look at some really in-depth science here. The other part of this analogy is how much water is in your cup at any given time. And this really represents the amount of stress that you're holding in your body. And again, to really simplify a lot of things, I want you to think about trying to manage 4 streams going into that cup. We're going to talk about moral distress. This is staring us in the face. I'm going to make an argument. It pretty much stares us in the face almost every day in the healthcare for the homeless environment. But now with this additional pressure and, anybody that's dealt with a virus before, like if HIV, a virus will find the cracks in your community, the cracks in your society, and run wild in those cracks. So we're seeing again, how racial groups are being impacted by this at disproportionate rates. And also now how the vaccines are getting into a lot more white people's arms than per the population. So again, this is something we go to work every day. My friend, Dr. Barbara DiPietro, uses the word advocacy to help me deal with this and cope. So, but we'll revisit this in more detail. Also, the emotional intensity. You can't talk to a social scientist about emotion without them comparing it to a virus. Emotions are contagious. And again, my good friend Deborah Bourne in San Francisco, she's like running the COVID response for the city right now. I'm so happy for San Francisco to have that genius of a brain coming out of our environment. Really, I think they recognized, she pretty much needs to be in charge of this. It's the fire we signed up to walk into because we're exposed to shame associated with trauma. These are natural emotions when you experience homelessness, when you've had a life in trauma. The shame, the hopelessness, the sense of unworthiness, depression, anxiety, fear, all these emotions. And, yes, it's the fire we signed up to walk into, but it doesn't mean it won't burn us from time to time as well. Also, the workload. We are carrying more of a workload. We're probably a lot of us working longer hours, which means more paperwork and everything that goes along with that. And then managing the stress of our personal life as well. COVID is, from an intellectual perspective, an interesting type of stress from a self-care perspective. Because if you're like me, COVID is dramatically impacting work. But I've got, 2 parents, a grandparent, and 2 step-parents that get most of their public health information from a news outlet that begins with an F, and they're not behaving. And if I make it through with all those people alive, I will be in somewhat amazed. I worry about that during work and how that's impacting work. But also we worry about our family members. We worry about our own health and wellness as well. So this is where we get overwhelmed very quickly because of the emotional intensity. A lot of times we'll talk about things like burnout. And when they say physicians are the most burned out profession, if you dig into the research, what they're also measuring is not just workload, but also the emotional cost of the work. What do physicians, nurses, social workers, social service workers, teachers, principals, police officers, lawyers all have in common? It's not that they necessarily have more of a workload than other professions. The workload's significant. Let's say it's a cause of stress, but it's the emotional part of the work. And then there's those things that intensify what goes in our cup. Is it a little drop of stress, or is it like turning on the fire hose? Let's pay attention to the first one, duration. We know, and I use the word chronic trauma to describe this in my trauma-informed care training, when you're under a high level of stress for an extended period of time, and 11 months is more than enough time, it damages the nervous system in the same way that a traumatic event does. Again, I use the word chronic trauma. Sometimes you'll hear small t trauma. There's different ways to describe it, but for a lot of us, this is COVID. We can call COVID a trauma. It's the same kind of trauma that I use to describe homelessness. For someone who experienced chronic homelessness, waking up on a shelter on a Friday morning isn't a traumatic event, but living experiencing homelessness day after day after day and all the stress inherent to it wears us down. And again, what we see damage prefrontal cortex, overactive fight or flight, sympathetic fight or flight response, again, the same biological things. Why we also dominate the top categories for burnout is because we care, because we're so passionate about the people that we serve. If something's not important to you, if your patients are important to you, you're probably doing okay, but we care so deeply. And then there's the uncertainty. On a day before COVID hit, is this person going to overdose? Are they going to be safe sleeping under the bridge? Will this housing program we're referring them to treat them with dignity? And so we already had this perfect mix for burnout. Throw COVID, throw the fight for racial justice, throw this political bleep show that we're in. Oh man, and we're struggling to survive. And it's okay to say that is, hey, we need to survive. We need to survive and bring the best self that we can to work right now. So I'm not going to spend much time on this slide. This is just for your information. This empathetic intensity, we know that emotions are contagious, and we now have the ability to say, because of our assessments, is a lot of us suffer from post-traumatic stress disorder, with the only identifiable trauma being the work we do. So compassion fatigue, vicarious secondary trauma, these are real dangers, and they're traumas. I don't put the word trauma on something if just because you had a bad day. This is something that overwhelms us, and these are real dangers inherent to the work that we do. Where I want to spend a little bit more time is this idea of moral distress and injury. I find this really great that we're talking about this now. Over the years, I've used some different language to talk about this. I've used words like expectation burnout, and you'll see it in here, moral safety. But again, and looking at the history that I've done over the last few months researching this, really coming out of the healthcare setting, this idea of moral distress and injury. And this will make my self-care training slides from here on out. I like this language even better, and I like that we're talking about it. So I'm happy to change my language because, again, talking about the same thing, but again, putting the label on it that's more recognizable so we can really start talking about this. So what is moral distress? This is where our actions are forced to deviate from our values, expectations, moral and ethics. And we do this all the time. Working in scarcity sometimes forces us into this. One issue of moral distress, and I see this all around the country as I work with shelters, as I work with day treatment centers, as I work with healthcare for the homeless providers, federally qualified health centers, is a lot of you do an amazing job and you create a safe place for folks. They may not feel safe anywhere else. So what do? They maybe start to camp out on your porch, in your courtyard. In other words, you've created a hub of safety for them. In other words, you've succeeded. You've succeeded in creating that safety. They feel safer sleeping on your porch than anywhere else. And yet, as a provider, I've worked all day to try to make a dent in homelessness, not just treat those that are ill, but with the goal of ending this epidemic in our community. And I've got to walk by those bodies that our community failed to house that night. I got to drive by that encampment on the way home. And so, every time we see this, I was working with some providers talking about motivational interviewing, and it's like, yeah, we work really hard to find people motivation to go into housing programs. But then how do we keep motivation when once they're ready, we have to put them on a 9-month waiting list? I don't have an answer to that question. It's the best you can do, because, you've worked so hard to get them to that point. So, hopefully on most days, we don't feel like we have to act against our values, but those expectations can be the tricky part. This is what I used to call expectation burnout, because, especially entering, I started my career out and my housing career out too, working with transitional housing. So youth coming out of juvenile justice or foster care. And I really thought I was entering systems that were there to really help children change the trajectory of their life. What I walked into was an incredibly underfunded system that kind of housed people a little bit and then threw them oftentimes back into really chaotic and oftentimes dangerous situations. Oftentimes I would make referrals to other programs, and my folks were treated with maybe with no dignity. They were treated terribly. And I know sometimes my folks make it hard to treat them like, oh, we're so glad to see you. But, come on, have a level of dignity, ethics in this. And this is where, we have an idea of moral safety. I hope for everybody on this call, you get to go to work every day for an organization that you feel they're doing everything they can. No healthcare for the homeless providers. So many of us, we're above average on this. We act every day, every minute in the best interest of those we serve. One of the ways I've seen this happen, and again, I was using the word moral safety, which I still think is good to add to the idea of moral distress, is if I feel like my organization is not acting in the best interest of the people we serve, there's no better way to destroy an organization's culture. I've been a part of some crazy situations, especially early on in my career. I worked for some terrible organizations where staff did not feel like their leadership was acting in the best interest of the clients and patients we were serving. It created them versus us. In the trauma literature, we'll call this trauma bonding, because if we feel we have to do something that is hurting the folks we're trying to serve, that eliminated that moral safety. We got into the fight response, and I've seen been a part of 2 organizations where staff organized, went to the board. I left another one where the staff, my heroes who stayed, formed a union to try to fight administration. The horrible thing is, if you're doing that, you're not necessarily focused on delivering world-class services. You're worried about creating some sort of umbrella. And in middle management experience too, I tried to create umbrellas of wellness to protect my staff from the craziness in other parts of the organization. We can't bring our best self to work over time if that's our reality. Moral injury, another word that's gaining a lot of traction, and I'm so glad it is. I just say this is the trauma that results from having to go to work and feel like we're not doing the best for those we're trying to serve. If we have to act against our morals, and I know with COVID, when resources maybe even stretched thinner, or staff are even stretched thinner, watching folks have to triage. As a healthcare provider, and again, best thing Dr. Fauci tells me to do is stay in my house and not go out. And when I walk my dogs, put a mask on. But I worked with some early on in the pandemic, some folks in New York City that had to walk home by, semi-truck trailers that were morgues, and just that sort of pain, holding up the screen so the family can say goodbye through Zoom. Again, all these things that just are so challenging for us, and we can call this trauma because that's what it is. That's what it is. Not just because, hey, let's be pity on ourselves. No, because this meets the criterion clinically for something that overwhelms our ability to cope. There's the other side of this too. Like I said, whenever I talk about trauma, I love talking about trauma because I love talking about the post-traumatic growth. So we need to understand whether it's moral distress or trauma, whatever it is, we also need to focus on something called moral courage or moral resiliency. Again, one of my heroes in the field and such a huge teacher of mine, Dr. DePietro. I don't know if she's on this call or not. I still haven't got a review from the latest Wonder Woman movie from her. So if she's on the call, I better see something in the chat. But, she helps me, my frustration, channel that into advocacy, right? I learned early on that just yelling at people because I was so frustrated didn't really get to change, but to be strategic about it, to try to say, okay, this can be better. How do I bring a regulated self to this problem? Doesn't mean I don't go march from time to time. Doesn't mean I don't chant from time to time. I still show up. But when I'm working with policymakers, when I'm working with faith communities, when I'm working with school districts, I'd want to try to find some common ground, find some common value, so I can help them see that they can do this better and they can give better care. All right, let's talk about what we've talked about. Like I said, if your cup's not full right now, get your own coffee chat and I will attend it. Again, what we're under right now, we may have to say, hey, how do we best survive? And then we've got to start thinking once, normal, whatever that looks like, starts coming back, how do we recover? How do we recover as individuals? How do we recover as organizations? So if we don't, we're in trouble. And this is where I'm really scared for a lot of you right now. Again, we weren't doing good before the pandemic, before the political unrest. We were burned out at such a high rate. And there's a cost to that. Burnout isn't something that, oh, I'll think about it when I have time to think about it. No, this takes away years from your life. It hurts your relationships. And the other thing is it really impacts our ability to bring our best self to work each and every day. So this slide is just we've got to not carry this stress too far into the future, or there's some real mental, social, and physical consequences to this. So the other piece that I want to send you away with is, okay, what do we do with all this, Matt? Yeah, we're burned out. We're traumatized. You've given us maybe another word of moral distress and moral injury. Okay, what do we do? And I want to make this very simple. And again, we may need to focus more on recovery at this point. And I'm giving you permission to do that. But I use this really, like I said, I like to put everything under the banner of helping fatigue, a 4-stage model of helping fatigue. Again, not being a brilliant man, got to make things simple. So I think one of the things when we get back to normal is really thinking about our work from a mental health perspective, from a burnout perspective, is dancing in and out of stage 1, which is exhaustion. Obviously, the goal of self-care, the goal of leadership within organizations is to keep ourselves in the healthy, motivated, and engaged. In other words, we're not carrying around too much stress in our cup as much as possible. But I would say for most of us, once a month, we're going to dip our toes at least in exhaustion. Now, what does exhaustion look like for most of us? We may feel a little bit more depressed or a little bit more anxious than normal, might have trouble sleeping. Again, we're not talking about mental health diagnosis. We just don't quite have the same energy that we normally bring to our work. So exhaustion, I'll give you some ways to kind of track this really concretely. But when we realize we're there, we need to have a plan to get out, because it gets pretty ugly as we go forward. Because here's where we also, and I've done some, when I have longer trainings, I'll do some Zoom surveys, and I've got only 10%. I've done this probably a dozen times. You add all those up, I only have 10% of people saying that they're not in one of these stages. Now, the majority of them have been in exhaustion, but there's a lot, almost a third, this shame, guilt, and doubt. And why is this so prevalent in our field is I've never met a healthcare for the homeless provider that has argued with me when I say, you need to bring your best self to work every day. Sometimes our best self is not enough. So when we know we need to be up here at this level, but because of exhaustion, we can only bring this. We need to be up here. We realize I can't bring the energy. I can't bring the same amount of empathy that I normally do. It elicits feelings of shame, guilt, and doubt. One of the common reactions to this is hypervigilance. I'm going to work harder. I'm going to work longer and longer. I'm going to be checking emails at 9, 10, 11 o'clock at night. I'm always connected. The thing that we have to catch ourselves, and this is where it really, really matters, is, as we go down these stages, not only is our own wellness, not only is our social and emotional intelligence, another thing, everything associated with our prefrontal cortex starts to decrease. We also aren't able to give the level of quality to our patients that we know that they need. So when we look at this model, which is again backed by research, is that as we go down this list, we're giving less and less quality of services to the folks we care about. What we're also doing too is we're not being the teammate we need to be. So we hopefully will take care of ourselves, for our teammates, and also for those we serve. As just to round this out, The next stage, stage 3, is cynicism and crisis. This is where it gets ugly. I like to think of exhaustion, shame, doubt, and guilt. Those are emotional reactions or state-based in some ways. Those are kind of a short-term reaction. At the end of stage 2, you start to get no enjoyment out of work anymore. In stage 3, all that stress and trauma becomes a trait of cynicism and callousness. Our heart becomes a concrete monument to who we once were. And if you worked with one of these people ever, you know that it's not a pleasant experience. And the other thing is, after training probably 10,000 plus people on self-care over the years, I've only had 5 people say they got in cynicism and callousness and were able to stay in their same organization and recover. 4 of those needed extended family leave. All 5 of them really engaged in mental health treatment. So again, we need to catch ourselves early when we can, because it gets harder and harder to get out. And then now that I do a lot of self-care trainings, especially at conferences, when you have all these great workshops, but you choose to come to Matt's self-care training, my marriage broke up because of work stress. I have cancer, and I think it's because of work stress. I'm not the parent I know I should be because of work stress. I hear these horrible, horrible statements from folks that just brings this to life in a very powerful way. So with the rest of my time, what can we do about this? Again, knowing that our cups are just carrying around too much stuff right now. One is, what I want to challenge you to think about is, what are your, what I like to call proactive self-care strategies? And you might find yourself later on down this. That's okay, we'll get there. But one of the things we need to do is take self-care seriously. You need to have a plan of, what are you going to do every day? What are you going to do every week to bring your best self to work? And this is more than, and I'm not against taking a bubble bath on a Wednesday, but you got to do more than that. If you weren't in the top 1, 2, or 3 category occupations for burnout, a bubble bath might be all you need to stay healthy in your job. We need to have a real concrete plan. It starts with the basics of health. If you're not sleeping 8 hours a night, if you're not eating well, I'm really nerding out right now, and I don't have time to talk about inflammatory versus anti-inflammatory foods. In other words, some things we eat will exacerbate the stress that we pick up throughout the day. Others will minimize it. Very fascinating stuff. So sleep, diet, movement / exercise. If we're not focusing somewhat on those, do. And hey, I'm giving my own self permission. I'm absolutely drop dead exhausted around 5 or 6 o'clock. It's okay if I don't have the energy to go for a jog, just to go for a couple mile walk with the dogs. I'm giving myself permission. Movement's key. Mindfulness, doing something, even if it's just 5 minutes of taking 100 deep breaths. We know what mindfulness does: calms the amygdala, activates the prefrontal cortex. So it helps to regulate stress. Also, if you practice it for a while, helps build the strength of your immune system as well. Making sure you don't lose your purpose and your passion. When people hit cynicism and callousness, I see what happens is they lose their why. Why are they doing this work? And if you lose your why, this job in and of itself isn't all that great, right? It's high stress. You could go make more money in probably some other environment. We get the privilege of going to live our passion, to live our values each and every day. The people that I see, especially get in stage 3, have lost that why. So holding on to our purpose is going to keep us grounded during tough times. Daily recovery, I've got a whole lecture of this for healthcare professionals. But when we can, to check out from work. And I know if you're on call, you can't do that, and that's part of your job at times. But when we can, especially if we're not on call and it's not required, to leave work at work as much as possible. Because let's think about the cup analogy. Your jobs are stressful before COVID. Now we got COVID, everything else going on. So throughout the day, the amount of stress in your body, the amount of water in your cup fills up over time. More stress in our body, the more we're going to shift to that amygdala. Hopefully you leave work, what you do, maybe you give yourself a little chance to process on the way home, but then you turn on your favorite song. Maybe you go for a walk, go for a jog, something like that. You eat a healthy dinner. What's happening is you go into recovery. In other words, you're not adding a whole much more stress to your cup. and it's recovering because you're doing healthy self-care skills. Let's say then after dinner, like 6 o'clock, you pick up your phone, because I can take work anywhere with me now because I got my work email on my phone. I check email. What do? We do two things. One, we stop the recovery process. Two, not every email is just going to tell you what a beautiful, handsome, wonderful person you are. It's going to ask you to do something. It's going to tell you something you did wrong. It's going to put another task on your to-do list, and it starts to fill that cup up. So whenever we can, this is important for vacations, weekends as well, try to disconnect. I know it's not always possible, but when we can, especially right now, we've got to try to get time away from the stress at work. Also, whenever, and I know this is hard right now, when we can hang out with people that bring joy and love into our life, even if that's over Zoom, it's not as good, I know, but trying to have those positive social connections. Second piece of the little bit that I want to give you is try to know your triggers. You might be experiencing some of these now. It just helps you assess where you're at. So my number one, the easiest for me to identify, are my physical triggers. We know that pressure points or trigger points throughout your body, mine that gets activated is my left shoulder, but these trigger points throughout our body are highly connected to our sympathetic nervous system. So when we're feeling more anxious or we're releasing more cortisol, what happens is these trigger or pressure points get tighter. And so what we see then is that aches in the neck, the shoulders, the back. So a lot of times your body is going to tell you you're carrying around too much stress. Other psychological triggers. Again, we're not talking about mental health diagnosis here, but you may be a little bit more depressed or a little bit more anxious. So, and sometimes you might feel a little bit more depressed and a little bit more anxious if you've experienced that as well. Also with one of my psychological triggers is trouble sleeping too. Sometimes I know early on in exhaustion, I'll have trouble going to sleep because I lay my head down on the pillow and I remember all the emails I was supposed to send. If I'm in this shame, guilt, and doubt, what I do is I wake up at 3 o'clock and I can't get back to sleep. And that happens almost on a nightly basis. The final thing is social triggers. If you got kids at home, they're great measures of this. Are you having less patience, both in work or outside of work? Is empathy, is compassion becoming harder and harder and harder? The other key of this, and this was where we might be, is having a already established reactive self-care plan. So when you feel those triggers, what are you going to do? One of the best tools we have, and you can go have a healthy weekend, this is our time off. And I was really encouraging people in the early, late spring, when it looked like we were going to hit a second wave in the fall. How do you get people time off in any way you can? Be creative about it. Can you work an extra hour to get a half day, maybe on a Friday or into the week? How are we going to get people away from work? And I know during a pandemic, taking time off, probably not something you can do. Let's not be pie in the sky, fantasy world. We should all be taking 2-week vacations right now. But when we hit that point where we can start thinking about recovery, let's start getting people away. And if any way you can even give someone an extra half a day off right now, this is going to be one of the best ways that we're going to recover. And the final piece I want to throw out here, because don't you dare stigmatize your own mental health services, is therapy. If I have any leaders on this call and you call yourself a trauma-informed organization, I know most of you have this, is you better have, your staff better have access to very cheap, but really free therapy. Hopefully through an employee assistance program, maybe through insurance, but we need therapy right now. And when I say we, I'm looking at myself as well. And if you're a leader on this call, here's my challenge to you. Is you better know how to access that therapy. In other words, you better access it yourself. If you're a leader right now and you don't feel like your mental health has been impacted by this whole thing, I think you're probably in denial. So one of the best things that you can do, because we need to destigmatize this, is to go, if I got physicians on this call, I'm talking to you, nurses, I'm really talking to all of us on this call, is, but for leaders, you better give a first person account of how people access that mental health support, because this has been a trauma pretty much, I believe, for all of us. Now, we may stop one day and have a 3-day weekend, and it may all hit us like a train. So again, making sure we don't stigmatize our own mental health. So that was my quick 40-minute rant into moral injury, moral distress, throwing some other challenges in there. It's not enough. I know that. So I want to give you some free resources. Again, you got like 220 hours of me on podcast if you're interested. Also, I wrote a COVID book. I learned about heart rate variability as a way to measure our body's ability to handle or recover from stress. I got really excited because clinically we could measure both the impact of trauma, but also, hey, we get people into a housing program. How does that impact their nervous system? We get people into trauma treatment. How is that impacting the nervous system that we know has been ravaged by trauma? Also, it helps quantify our own self-care. If you see a negative trend in HRV for 7 days, it's one of those triggers that your body's carrying around too much stress. Also can be a cool measure of organizational wellness as well. So if you want to nerd out with me more, the heart rate variability thing, I also want to give you free access to my self-care training because I know this wasn't enough. I'll give a shout out to my friends at Cincinnati Health Network. My sister, Kate Bennett, from a different mother, but sister in the struggle. We work together to create this training. I want to give it to you for free. So if you go to bigonlinetraining.teachable.com, I'll put this in the chat. You'll scroll down to the self-care training. If you click that, just throw in the HCH thanks in the coupon section. Make sure it's in all caps. You'll be able to access that for free for 2 months. This coupon is generalized. In other words, you can share it with as many people as you want to share it with. So if somebody wasn't able to make this call, but you think, hey, it's 2.5 hours, but it gives you a whole day worth of content, try to make it enjoyable. So I wanted to throw that out because I know 40 minutes is not enough. I go do a deep dive into self-care strategies, spend a little bit more time on the secondary vicarious trauma pieces as well. So if you think anybody right now in your organization can benefit from this, send them the coupon, send them the link. I think it's a pretty good 2.5 hour training, but I wanted to give you that free resource as well. So with that, I will turn it back over to C. I'd love to get your thoughts, feelings, experience, expertise on all this as well.
Thank you so much, Matt. And thank you for sharing that longer training that I'm looking forward to checking that out myself. I'd like to invite any of the participants to ask any questions about what Matt talked about. Also, if there are steps that you've taken individually or that your organization has done that you've found helpful, we'd love to hear that as well. And you can type in the chat, or if you'd like to share your video and speak up, feel free.
I can't hear you, Bobby. Can everybody else hear Bobby? Bobby, I want to hear you. I can't hear you, my friend. We're resilient. So as Bobby types in, okay, we got it here. Not everyone can do this, but I find it helpful. Okay, I'm going to just read what Bobby says. Not everybody can do this, but I found it helpful to stay away from news one day a week or so. Yeah, I think, I found myself, I'll be honest with you, a little addicted to the drama. And to cut back, I think is really good. I think we're in a tricky position, Bobby. I imagine too, is on one hand, we got to keep track of that craziness. On the other hand, how do we stay healthy in doing that as well. So give yourself permission. Just maybe probably check the National Healthcare for the Homeless website every once in a while. They do a great job of keeping you updated on all this. But yeah, I think too, I give myself an hour a day, and that's it. And that doesn't count the daily show, because I give myself that permission as well. So another one, how can non-leadership staff get our leadership involved and bought into self-care culture at work? If I can, I just want to throw out, if I can help out, I'd be very happy to do that. The thing that we have to internalize, and if you have open communication with your leadership, I hope you're able to have this conversation. If we are experiencing burnout, and again, statistically speaking, the folks on this call are at the greatest risk for that. Our quality drops. We're not able to fulfill our mission in the way that we need to fulfill. So honestly, we are the worst audience to hear a self-care message. And I'm part of that, right? I just thought being burned out was part of doing the work of helping and healing. And I actually said that out loud a few times, unfortunately. When I dove into the research is, I got to give the best quality of myself each and every day to those I serve. And if I'm not healthy, I'm not capable of giving my best self. So that to me is the sales pitch, is if you're burned out over a long period of time, you're going to destroy your own health. You're also not going to be the teammate that's going to positively contribute to a healthy culture and support other staff. And you're not going to give the quality of services needed to the folks that your mission tells you needs to be happen. So I try to approach this from, that quality perspective. If I still can't get you to buy in, and this number is easy to get Googling, so it may have changed in the last 6 months since I've Googled it. It takes around $1 million to replace a physician. It takes around $60,000 to replace a nurse. So even if you have a healthy staff, if you have a staff that is engaged, if you have an engaged workforce, you are going to save money supporting your staff. So I try to go from the quality perspective. I can go to the financial perspective if need be. But, we're also in the business of helping people struggling with stress and trauma live healthier lives. If we're not valuing that within our own selves, what are we doing, right? What kind of hypocritical behavior is that? So not saying that your leadership is hypocritical, but we've got to take this serious. We are in the arena of helping people live healthier lives. We got to live that. We got to walk that walk. And when I talk to leadership, I challenge them, you got to be the role models for your staff. As staff, you've got to be the role models for your patients. So if we're living unhealthy lives, what gives us the right to tell other people to take better care of themselves? So I think part of that's just stepping back and looking at this from that point. Please type more questions, because I'll just keep talking on this subject as long as I have, which is 8 minutes left. So please type in and keep going. But again, one of the things that I really think to operationalize as well is a lot of people, I think, shrug off the idea of self-care. I got to give credit to the HCH staff for coming up with this title to a pre-conference workshop back several years ago and I've continued to use it, is self-care is quality care. And so I think to start to look at that and use that language, because some people are like, oh, we don't like self-care. I don't care what you call it. If you don't take care of yourself, your patients aren't going to get the type of services that they need. So that's that real crucial point. All right, well, I'm going to talk about one more thing here, because if you're going to give me 3 or 4 extra minutes, I'm going to use it. And I want to talk a little bit about diet, because while full recovery might not be possible, you're surviving right now. And I know, let's just say, eating unhealthy food and drinking a lot of booze, and I live in Colorado, so we can do other things as well, is a great short-term coping skill. It makes me feel better in the moment. Obviously has long-term consequences. 2 things I'm really focusing on right now. One, I have a little struggle bringing it up because it costs about $200. That's an allergy test. We have what I believe, I'm a mental health professional, so take that as it is. But a lot of us, and I think about this from our client perspective, patient perspective as well, if you're eating foods that you're sensitive or allergic to, it's going to exacerbate the inflammation associated with the stress response. So one of the things that I really looked at is the diets of the people I was trying to help as a mental health professional and how horrible that was. So if you're really finding yourself struggling, your diet might be contributing to that. Also, and if you look at my self-care training, this is spelled out in a lot of detail, is inflammatory versus inflammatory foods. So inflammatory foods, things like processed food, lots of sugar, unfortunately, alcohol makes that list, basically bad oils, basically everything you know you shouldn't eat. What that does is when we're stressed out, we don't only release cortisol, but also cytokines. Cytokines are great if we have a cut. They rush to the scene of the injury, create inflammation, start the healing process. Cytokines, let's just use COVID. If a virus is in our system, it will help fight off that virus. Again, I'm a mental health professional talking about this, so take it with a grain of salt. One of the things I'm seeing with COVID is that the cytokine, there's more cytokines continue to be released even after maybe some of our symptoms are due. So what we know is when we have that high cytokine release, we get leaky gut syndrome. In other words, our gut health. If you can just imagine what crap literally leaking out of your gut would do to the rest of your body, it's not good. But mental health perspective with anxiety, depression, other mental health, we actually also see inflammation in the brains. So if you go then eat not anti-inflammatory food, you minimize the impact of the stress in your body. In other words, you're fighting that inflammatory response. Again, we know what we should be eating, right? Nuts, berries, healthy oils, good protein, lean protein, chia seeds, flax seeds, those sort of things that most of us know we should be eating. Isn't just good for our physical health, it's also good for our mental health as well. So again, a lot of this, you might not be ready to start an exercise program because you just don't have the energy for it. Hey, I totally get it. But maybe just trying to improve even one meal a day can really help you minimize that impact of stress on your body. So with that and a little bit of movement, because movement helps burn off that cortisol. If you get a good exercise in, get some endorphins going. And again, if you ask me, what's the one thing I can do to bring my best self to work the next day? It's try to get that 8 hours of sleep. Try to prioritize sleep, diet, and exercise right now. Even if you're not in the mood for exercise, go on a walk, get a mile in, get some steps in. Because again, that is going to be some of our key coping strategies right now. So I could talk for another 3 hours on this, but it's called a coffee chat for a reason. So I just want to, thank the National Healthcare for the Homeless Council. You continue to give me a venue to work with the great providers out there. So everybody, thank you for continuing to think about me for these. And just for all you providers out there, all you professionals, thank you for all the work you're doing. There are people alive today that would not have been alive if you weren't there to give them not only medical care, but also the compassion and the empathy you give them every day as well. So I know we're not in the business where we get a lot of thank yous, but thank you for everything you do, for providing hope every day and for keeping folks who need to stay alive so they can find that healing path for themselves. You're the ones that give them that stability to take that journey. So thank you, everybody. Keep up the amazing work and please take care of yourselves.
So true, Matt. Thank you so much. I want to ask our participants if you wouldn't mind taking a couple moments to give us some feedback on this webinar. Brandon is going to post a Survey Monkey in the chat. And if you could just let us know your thoughts and any suggestions for future sessions, we would really appreciate that. And like I said, we will send out an email next week with the new double issue of Healing Hands about coping with stress during the pandemic. Definitely check out Matt's self-care course that he shared and the coupon code in the chat, HCH thanks. Anything else?
All caps. Just remember all caps. Nope. I just, again, a big thank you to everybody.
Thank you, and have a great weekend, everyone.